Good morning and welcome to our King County Equity Now research team spotlight and community accountability submittal. That's myself, Imani Dinish, he, him pronouns, member of the King County Equity Now research team and concerned community member trying to see change.
My name is Lateah Holmes, she, her pronouns, and I'm also part of the King County Equity Now research team.
And today we are spotlighting an organization that I've grown to admire and collaborated with in some way or form and seen their visibility in the community. It's TubmanHealth.org, being represented by two community members, local people. Would they like to introduce themselves?
Hello, my name is Danisha, Jefferson-Abeye. I am the founding director of the Tubman Center for Health and Freedom.
And my name is AyeNay Abye, and I sit on the board of directors for Tubman, and I go by they, them, and she, hers.
And I use she, hers.
Right.
Thanks for having us today.
Thank you, guys.
Thanks for being here.
You know, we're getting ready for the submittal for the participatory budgeting initiative deal here, since we haven't done it in Seattle before or King County, and we want to spotlight organizations who could be greatly helped by the funds becoming released, if you will, to their proper usage for true public safety and public health. And you guys were the first people I thought of. You're already doing great work, you know, in this challenging time and helping people out. So I'll ask the question first, and Lateah is also going to moderate. What is the Tubman Health Center?
All right, well, the Tubman Center for Health and Freedom has been in the works for many, many years, but we just founded the organization this spring, actually. It came out of a need, really all that we were facing this spring. It was a time where, you know, we really felt like people would understand, you know, that intersection of health and liberation like maybe they hadn't before. And it was really a time where people were willing to have conversations that they weren't willing to previously as well. So the Tubman Center for Health and Freedom right now is a health justice organization that's going to be a community health clinic that provides integrative medicine, which is often what is found to be more culturally appropriate. And it will be a family medicine clinic as well. So working with populations from, you know, 0 to 100 plus. And we really focus on people who have been marginalized by the mainstream medical system. So we were founded by 6 grassroots community members from the Seattle area. And we, I think out of the 6, 5 of the 6 were Black community members. 3 of the 6 were members of the LGBTQ community. And so, you know, we're centering those folks along with other Black and Brown communities, disabled folks, disabled communities, immigrant communities, LGBTQ communities. So people who have really been forced to the margins, who haven't received good health care. So yeah, that's Tubman. So you can add on to that at all?
I would just say a little bit about the timing. We're 5 years ahead of schedule of when we thought we were going to launch. We've committed ourselves to this process. However, how the dual pandemics of racism and COVID-19 are becoming more visible to people, we've always known that as a community. Public health has been a systemic issue around our communities not getting what they need. And the idea around the use of systems and power on our body directly connects to health and freedom. And so we saw this as a critical time because it's not just around our individual health, but it's about our community health, and it's what's also happening to our community health. It's not a zero-sum game. This is we are under attack, our bodies, control, power, and how that impacts us. And so we were like, the time is now. And so we felt like 5 years ahead of schedule, but we're going to do it.
Nice.
That's awesome. So you're saying you're going to open up a center. Would the goal eventually be to open up multiple centers, or are you going to focus mainly on this one?
The goal right now is to do one really, really well.
Okay.
What happens frequently, you know, particularly in models that are supposed to be for our communities, is, you know, things are oftentimes either piecemealed or, you know, cheapened by trying to spread it about. We believe that if we build the high quality healthcare center that our people want and need and are asking for, then you know, folks will come to it. So we see evidence of that now, really. You know,
Yeah.
The centers that do attempt to address our needs the most, our folks are willing to drive past another 3-4 clinics to get to them. So we believe that if we build the model, the people will come.
Okay.
And our goal also is to be building this in collaboration. It's not our center, it's our center. So the people will go where it feels like home.
Right. Speaking of that, I know that TubmanHealth also had a community reach out podcast. I was sat in on that, and it's interesting that you guys have taken into account trauma-informed care. As AyeNay said, there's so many people who've been marginalized and disenfranchised by the way the health system works. What's going to differentiate this clinic from the other clinics or medical facilities that people are accustomed to, that have this well-earned stigma of disenfranchisement?
Yeah, we are going to, in our design process, really analyze every piece and section of the healthcare delivery system and reimagine it and redesign to meet our needs. You know, I guess I would point to a personal story that was shared, and I have permission to reshare. It was a friend whose mother is afraid to go to the doctor. And now that's a common story for many, many of us who have family members because of the trauma that we've received in that system. And so that, you know, despite what might be going on, she will not go to see a medical provider. And so, you know, what would it mean? And I know our board talks a lot about, you know, going into a facility to get loved on. You know, what would it mean to really transform the healthcare system to where that mother is no longer afraid to go in, but it's a place where she wants to go, where there's someone who meets them at the door, and, you know, goes through the process with them. Yeah, do you want to add on to that?
I'll just say my own personal story, you know, thinking about giving birth to our second child. I said, I'm going to give birth at the hospital because this is crazy. I need the drugs.
Right.
I knew that.
Right.
And then I got to like the last month of my pregnancy, and I was like, and I started to really understand what was most important to me, and it was my health and safety. And I had little confidence that the actual hospital could provide me that at my most vulnerable time. And at the last minute, I was like, I'm giving birth at home, no drugs. You know, and 8 months later, I was like, you know, from the time I thought I was going to the hospital, I really I could not get myself to go there. And so I was like, I had all these crazy thoughts in my head, like, that are real. Like, I'm laying on the bed at the hospital and they say something crazy about my queerness, about my relationship, about my family. And what am I going to do? Jump out of the bed while I have the epidural in my back?
Right.
You know, so you have the fact that we have to weigh out these things around our health and safety, whether physical or psychological. There's harm being done to us, to my baby, to our families, when we're in our most vulnerable places. So how do we ask people to be vulnerable? That's the most important thing around your health, is to be honest and vulnerable and have the space to ask yourself these questions. What is going on with me?
Mm-hmm.
And then to be able to say it.
Mm-hmm.
And we cannot do that right now.
And, you know, a lot of that goes back to how these systems are formed. And, you know, our people are relational people. We have to be able to have a relationship with the providers. But if the providers don't understand the etiology, the like source of the disease in which that, you know, the very source of our disease, which is in most cases our conditions, then, you know, how are they going to treat us? How are we going to be able to open up and have those real honest conversations and expect to get well instead of having just Band-Aids? How are we going to really address the root causes of these diseases if we don't have providers also that are trained to do so and come from our communities? Mm-hmm. So that's another focus of TubmanHealth. You know,
that the system's sick.
The system is sick. And rather than reforming, we really have to start from the ground up, and that's what we plan on doing with the Tubman Center.
Okay, see.
So,
go ahead.
Okay. So when it comes to the Tubman Center, as you just mentioned, so what would success look like to you?
I think it's, as Danisha was saying, you know, we are building this as a collective. And we know so many folks who play different roles in the community, and there's no place for them to go. Yet they provide health and safety on a daily basis to our community. And so success for us looks like the people who are giving health and safety also get that at the center. And this is a place for everybody, that I can go get healthcare, that you can go get healthcare. The people we're pouring love and health and safety into, they're also getting healthcare. And so for us, health and freedom go hand in hand, and that this is a space where people feel that they belong, they feel connected to a space of healing, a space of challenge, but we're in it together. And that it's integrative. It's not only integrative modalities of different things that you can receive there, but it's integrated around your identities. You are at the center. It's not like, oh, because I'm queer, now I got to go over here to the queer clinic.
That's crazy, yeah.
Oh, do I go to the queer clinic or the women's clinic or?
Right.
Mm-hmm. Yes. Wow. Place where people are at the center of the care that they receive. I would say also, I mean, it's a place where people want to go, right? That I think we'll know we're successful when we also see policy wins. You know, part of what we are going to do and are doing as the Tubman Center is also looking at policies, because, you know, most of our health comes from our conditions. So as much as we can, you know, address the systemic conditions that are making us sick, that will be a huge factor in how well our health outcomes are. So, and like baseline, our people will start getting better because we are able to address those root causes. It'll be, you know, health will become habitualized as well. Folks in our community will be able to make it a part of their daily life because it will be that accessible.
Yeah, so that's interesting, because by creating a community around health and wellness, it just seems like the normalization of one's health or the community's health will make people live a healthier lifestyle, because it's such a taboo subject. You know, somebody says, well, how's your health been? They say, oh, it's okay. When are we gonna go out to dinner? You know, people don't want to talk about those things. Similar, like talking about money is taboo in a lot of in the BIPOC community. So it's going to be nice to see a organization that has a lens toward building community and talking issues of freedom and justice and wellness. I heard that you guys, from a little bird, that you guys had a frontline wellness program. Frontline, what was up with that?
Yeah, that was a program that we launched this spring, shortly after founding, where we were connecting and are still, it's still an active program that we're running. We're connecting community members who are in need of healthcare with East Asian practitioners, acupuncturists, who are providing a series of free acupuncture visits to members of our community who are in need. And so, you know, oftentimes a lot of folks, you know, have their fear of going to see a medical doctor. You know, certainly there's some situations where you need to see a medical doctor, and there are also plenty of situations where there are other providers that could also help address root causes of conditions that people face as well. So particularly with the stress that our community is under right now, and the trauma that folks are experiencing, especially in the Black community of this Puget Sound region. But it's open to Black and Brown community members. You know, it was during a time where a lot of organizations were putting out Black Lives Matter statements. And we were really like, you know, that's great. And we would like to see people action, you know, make that actionable.
Mm-hmm.
And so we asked an organization, a company to provide free healthcare.
Right. Put their time and money where their mouth is.
Yeah. This particular company said yes. So Acupuncture Northwest and Associates was our first founding partner. What makes this program unique is that, you know, folks are not getting acupuncture in a community setting necessarily. So if people wanted private sessions, they can receive, they do receive private sessions. They're hour-long sessions. In addition to that, people receive a series. And so again, our community is relational. One of the issues we have is with continuity of care. So folks have the choice of seeing the same provider every time they go back and are able to receive a series of visits as well to treat whatever conditions or issues that they are dealing with. So we're really excited. We've received amazing feedback from the folks who have taken advantage of it. And we still have a few slots available.
Good.
So have you guys faced any challenges with Tubman up to this point?
Yes. What kind of scale are you talking about? Like, what's?
I mean, just kind of with getting it up and running. I know you said 2025 is the date, but on that, if so.
Yeah, I mean, really, we've, in terms of like momentum and all that, like there's so much excitement and energy and community momentum around this project. You know, people keep reiterating, this is what our communities need, this is what we want. And so in that sense, like our challenge is just keeping up, really keeping up with the need and the demand that you know, we're hearing. We're doing a lot of community visioning sessions. So we're asking the community to come in and weigh in on our design process. And with that, like, it's just more urgency every time. And so, yeah, we're in our infancy stage at this point. So we're still trying to develop systems and get our fundraising program off the ground, and really, you know, build out our infrastructure.
Yeah, I think that we have a challenge in that too. Demand, as Danisha was saying, but also a physical space. That's very important. The location of Tubman, like we said, in the community. So we're talking about, you know, asset acquisition, we're talking about land, we're talking about development. And so building those things while you're also running programming, policy advocacy, and you're trying to build
Design,
and design and co-create with community. It's a lot, but that's what the work takes.
Right.
And so part of it is a challenge around the long term. In 5 years, the building will open. Well, where is it located, right, is going to be a big thing for us. And so then you talk about accessibility in terms of community development and getting in the Seattle development scene, which is crazy. You know, private developers are running the game in Seattle as in any other, like Manhattan. And so for folks, this is their neighborhood, but they can't contend to do community development in the same way because of gentrification and because of how corporate developers have just made it impossible. So for us, the health and safety part, we got that. We're doing that. But to say in 5 years we're going to open doors in the Puget Sound, King County, you know, Seattle area, our biggest challenge is going to be going against the tide of corporate development in Black communities.
And that's the beauty of this, why I joined this research project, is to advocate and help reimagine what people with souls such as yourself who are trying to fight for freedom, but in our history, based on oppression, based on the corporate and just the way economics work in a free market society, is that we've always worked from a position of lack. And hopefully my hopes is through you guys being so gracious on this Saturday morning to be spotlighted by the research team, is that you won't have to work from a position of lack, and that we have a chance now to mobilize resources and funds to have programs and projects such as TubmanHealth.org, which is already needed and has been advocated for by the community, to work from a position like any other business would be if you were a for-profit per se. If you were opening up a hot dog stand, you can get a loan or a grant anywhere. But it's just, it seems like the hoops that they make us jump through, especially when we're doing something for the good of the collective, there are those challenges and powers that'll work against it, right?
Yes.
Yeah.
So what can any of the folks listening do if they want to help out? Like, how can they get involved?
Yeah, folks can go on our website, TubmanHealth.org, and sign up for updates. We have an internship program launching this fall and spring for folks who are interested in coming on as interns. We're going to be running several community visioning sessions over the next few years, honestly. I think our next one is slated for January, but we want as many community voices involved in this process as possible. So we hope to hear from community members to weigh in on their dreams for a healthcare system.
And we have 2 volunteer opportunities. So if folks want to come, we call our street team. It's part of our board. You know, we go out and go to community events. We do mass distribution at those events. And so if folks want to volunteer, they can roll with us to events and help us do mass distribution. We also need volunteers to help with fundraising. We have a goal to fundraise our first $50,000 from the community.
Yes.
So we need folks to help fundraise with us. You know, how do we crowdfund from our own community and get this going as a collective?
Right.
And we actually are designing a study similar to the one that King County Equity Now is doing, but specific to the needs, the healthcare needs of community members. So we're in the development stages of that right now. And, you know, folks can weigh in on the study or, you know, help with data collection on that as well as we go. So we have a lot of pots boiling right now. We also do a lot of trainings. So we talked about workforce development around healthcare workers as well. We've done some trainings around, you know, interrupting racism in the healthcare system as a healthcare provider, and challenging racist beliefs that are still taught in medical schools today. So we do a lot of those kind of training opportunities as well. So lots of different ways to engage and work together. We look forward to, you know, connecting the community in a variety of different ways.
Yes, and our community is very skilled, and so even if folks are doing their own trainings on other subject matters, you know, if you also want to partner with us, do a training on behalf of TubmanHealth to raise money for TubmanHealth, donate what you were gonna make for your diversity, equity, and inclusion work at Microsoft or something, and donate what you'd make to Tubman. That we're totally down to partner in so many different ways, again, to build the center. Let's build.
All right. You guys are game changers, and I don't want to take up too much of your Saturdays, but I appreciate this. Again, it's just a spotlight. I'm glad to be working with Lateah and working with you guys, and, you know, let's get it done. I would love to. I love the fact that you have community buy-in and it's so inclusive and it covers such a broad spectrum of the diverse community of our region, because they so often try to pit us against each other. So your personal stories and sharings were very much appreciated, because there's, you know, so many dynamics in that, you know, being Black women in the queer community from Seattle, you know, and then healthcare workers, frontline workers. So there's so much involved in this. Thank you, and we'll see you later on.
Yep.
Thank
and we'll put all
you.
the links in below.
Yeah.
You can check out their website, you know, get involved.
Yes, yes.
Thank you so much for taking the
Yes.
interest and taking the time to hear us today.
And
All
nice
right.
to meet you, Lateah.
Yeah,
Nice to meet you too.